Children's Care Hospital and School presents In-Home Behavior Therapy. Little Benjamin's Journey.
The experience was nothing short of wonderful. It was a cold, blustery night, and went in at midnight, and he was arrived by 3 o'clock in the morning. So it was a very, very fast delivery. He had a very direct flatness in the back of his head, which really concerned us.
And then that kind of proceeded off into the direction of slow sitting up, slow rolling over. And then with the concerns that we had with Ben as far as social skills and development came a little bit later on.
He actually was diagnosed with plagiocephaly and torticollis. So then, we were referred to the CCHS rehabilitation, and right away when we went there, we were so impressed with the facility, with the staff, and they just seemed so knowledgeable about what was going on with Ben. And he had the cranial remolding.
And that's about the point we got involved with Birth to 3.
Mm-hmm.
And we started working with a physical therapist, and at the same time we're doing the remolding and working on his flat head. We're also working on the torticollis with the physical therapist.
Right after that, we just continued on noticing that he wasn't meeting his developmental milestones. After the initial assessment, we went through the full evaluation assessment at Children's Care. They did a really thorough evaluation, and after that, they came back with the test results.
Yeah, and they gave us the diagnosis of autism. We were kind of surprised, we were definitely surprised. But at the same time, it kind of answered a lot of our questions.
And I feel like it was kind of a relief because we knew that there was something going on, and this was like, we knew, it wasn't anything that we did,
Mm-hmm.
And we just wanted to do what we could to help him. So it was the right step in the right direction.
But I think we were still struggling with what we could, if they were behaviors or if they were, tantrums, meltdowns, and things with his behavior that we're really struggling with, that we weren't just finding a lot of success. I mean, those other therapies just, weren't addressing that.
Mm-hmm.
I guess, they weren't obviously meant to.
So Chris and I began to start doing some research and things on our own. What's out there? How can, and we heard about the ABA, the In-Home Behavioral Program. Brought it up to our Birth to 3 coordinator, and he said, tell me more. Tell me, what can this do? How are we going to go about doing it? And how is this going to be beneficial for Ben and your family?
In-Home Behavior Therapy utilizes the principles of Applied Behavior Analysis, or ABA. Applied Behavior Analysis is a systematic teaching strategy that's data-based. While ABA is the only research-based methodology approved for teaching children with autism, the principles of ABA are appropriate for use with any population, regardless of ability or disability.
And so immediately we called them and talked to several people that were involved with it. What was it about? They answered all my questions, and that kind of started the process. And we had a meeting and kind of told us what services were going to look like, how this was going to help Ben, what goals that we're going to be working towards. And so we were ready. I mean, it was time. We needed something else.
Mm-hmm.
I mean, we were ready to take it to the next level with Ben. It was the perfect time. And not only do they focus just on the child, I mean, it was how you as a parent can help your child.
It was more about adjusting our behavior and doing things consistently, mm-hmm. and changing our approach as much as it was dealing with his mm-hmm. behaviors.
It's a team approach and it's objective based, and I think just meshing everybody together, the support is just amazing.
Children's Care in-home behavior therapists Catherine and Carrie began working with Benjamin. They taught him how to make appropriate requests, making choices, self-help skills like dressing himself, washing his hands and face, taking a bath, and washing his hair, transitioning to activities, independent play skills, taking turns, sharing, interacting appropriately with peers at preschool, and requesting help.
Probably after the first 2 weeks is when we already started to see him responding, which was, I mean, out of my expectations. I didn't think it was going to happen that fast. It was great. I mean, to start seeing the results.
We were experiencing that every night, where it was a tantrum before bed, tantrum for bath, tantrum because he didn't want to eat anything. We learned about the rewards, first of all. If you do this task, then you can have this. And we found that was kind of a powerful thing to keep Ben on. Okay, once you're done with your bath, then we can do what you wanted to do.
It's just amazing to see how he was responding. And with a therapist, they're so supportive too, as far as, I mean, they encourage you as a parent. They're like, you can do this. You know, remember last time that we did this and we got through it? Last time it was 5 minutes, and now this time it was only 2. You did it, and it's just a team effort, and all the way through, and was so wonderful. Before we started the therapy, I mean, an outing, which I would call leaving the house, which if it would be anything from like going to get groceries or to go to the post office to get stamps, was pretty much non-existent. Part of his therapy was getting Ben out there, getting Ben in the community, getting him to go to the grocery store, taking him out to eat. And after like the first time we were at a restaurant, we had a meal together, we enjoyed it, we had fun, and we left. Was just like, wow. I mean, that was a huge success for us.
For us, it was a major difference. It was a major change in lifestyle. I think a lot of our strategy changed from reactive to proactive.
Yeah.
Instead of, we would kind of like react to things as they came.
And now we can stay ahead of it. With this program, with these techniques, it'll change your life. It'll change your family.
For more information on in-home behavior therapy, call Children's Care Hospital and School.